we are now recording. So I do want to check in to see, does anybody have any questions on the assignment, anything before we get going with our topic today?
I have a
For
question.
the assignment, do we have to submit it like
Okay, Kenny, I think
does one
you're glitching out on me a little bit here, buddy.
person in our group?
I'll tell you what, type your question into chat and Jen, she'll respond to it. You're glitching out pretty badly. So just to answer.
Did you hear me now?
I can hear you now. Go ahead.
So I was asking for the assignment if we have to submit, like if one person in our group has to submit it, or if everybody has to submit the assignment.
So for this week, there are two things that you have to do for the group. Now you'll have your individual assignment and your quiz and your pack back that's due. But for the group project, you'll have that little write-up, that little essay write-up in APA format that's going to be due. I just need that from one person in your group. If I get it from multiple people in your group, I'm just going to pick one and hope that that's your best version. Okay, so work together, figure out what you need to do to polish it up, make it look good, and give me your best product. Okay, so just one person for the assignment. Now the second part of the group assignment is the peer evaluation. So I need that from everybody. So if you're in a group, I do need a peer evaluation to evaluate yourself and evaluate everybody else in your group, and submit that individually. There are two different drop boxes for each of those, one for the group and then one for the peer evaluations. Okay.
I have a question.
Go ahead, Erica.
For the sleep journal,
Mm-hmm.
can I like take a picture of it because I have it written down?
Yeah, that's fine.
And what specifically like do you want us to like write in it? Because I've been writing like the time that I go to sleep, time I wake up, like what I do before bed, and like do I have to like write down the way I go to sleep, if that makes sense, like laying up or like laying down, like what exactly?
So the spirit of this, I'm not actually going to be tracking these per se. I'm not going to look at yours and then talk to you about it or anything like that. That's not what the spirit of the assignment is, that you learn how to track something, track a behavior, or track a problem area. And maybe you don't have any issues with sleep or dreams or anything like that, but this just gives you an idea when you ask your clients or ask your your cases, or I want to say subjects, when you ask somebody to track something, this gives you an idea of what they're going to go through, what the process is. And it's kind of exhausting, isn't it? Trying to remember to do that every night. But keep that in mind if you're going to be doing stuff as a case manager, as a counselor, or as an educator. So the details really aren't terribly important. I just want you to get used to what it's like to track something, especially when it comes to sleep. Does that make sense?
Yeah, thank you.
Okay. Yep.
Question.
Okay, I have a question.
Go ahead.
Okay.
So for the group project, if we have like two people that aren't responding to us, what do we do?
Do you have at least 3 in your group?
Yes.
And 3 of them are responding?
Well, including me, there would be 3.
Okay. I designed this group project to be run with 3 people. So I put 5 in initially with the understanding that sometimes people drop out of the course. Somebody might decide that they don't want to take part in the project, and that's all fine. So as long as you have 3 people, you're good. Just let me know through your evaluations that who's not responding. And then if they don't respond by this week, I'll check in with everybody next week and see who's not responding, and then we'll start making adjustments. We'll because I'm not going to give anybody credit if they're not doing the work. Okay, those people will be identified. All right.
Thank you.
Yep. And somebody else had a question.
I did.
Go ahead.
So if we're doing an observation or experiment, it said that we had to put our idea into the forum, but we couldn't find what is that? Where is it?
No, I could probably do a better job of placing that somewhere else. It's under discussion and it's right under general discussion forum. So, oh, actually, no, it's a group project. Where did it go?
Yeah, because we tried looking for it yesterday,
Oh,
and we didn't.
okay. I will work on that. Oh, I apologize. I thought I did have it in there. I have introduction. I'm sorry. Yeah, that's my bad. Yeah, I'll fix that.
Okay, thank you.
Thank you for letting me know.
What was that one more time?
So she was talking about if she wanted to do an observation. So if you're doing an observation, I'm not worried about it. If you're observing, the criteria for observing is that you're not interacting with your environment. You're not not interacting with the subject's environment. So if you're observing, as an example, I think I might have used this example on Wednesday, but if you want, for example, want to identify what races or genders or age groups that tend to roll through stop signs, you can put somebody pretty naturally on the corner and just track people that are rolling through that stop sign, right? You're not interacting with any kind of behaviors or outcomes. Now, if you chop down that stop sign just to see who gets into an accident, that's a problem, okay? Because we run the risk of injury. So as long as you're not interfering, you don't really need my permission. If you need to go into schools or whatever, hopefully that's not the case, but if you do, make sure you have the right permissions for people to, they're aware of why you're there. This is not a sanctioned research project. There's no I or B approval that we're going to be gaining from this. So I just want to make that clear. As long as you're observing and you have permission to be there, that's all I really care about, okay? But yeah, I'll work on that, that research forum just in case anybody does have questions on it. Okay, any other questions? Okay, so let's get started. I'm going to try not to give you, not to put you to sleep because we're talking about sleep, right? So I left you on Wednesday and we had discussed how the stages of sleep progress. You know, what do they look like? What's going on with the wavelengths in our, you know, we had the alpha and the beta waves and the theta waves and delta waves, and these are all signals that are produced by our cerebral cortex to tell us what stage of sleep that we're in, right? So we talked about that. We talked briefly about some problems with sleep. Now, within the sphere of mental health, we're very interested in somebody's sleep pattern. Why is that? Why am I so concerned? You know, I deal with mental health. Why is sleep a problem? Why do I want to look at sleep? Anybody?
Because the sleep you get has to do with can influence your day-to-day function, which can make any psychological issues worse if you're running on like 3 hours of sleep and your brain can't recharge.
Absolutely. So sleep problems, I'm going to break this into two different sections: sleep problems and sleep disorders. So problems that arise from sleep. So you said interrupts daily functioning, right? Interrupt. I spell, is it 1 or 2 R's? I miss having spell check. Interrupt daily functioning. Okay. In what ways does it interrupt our daily functioning? I think I spelled interrupt incorrectly. That doesn't look right. So how is our daily functioning interrupted? I think it is 2 R's. Think about it. If you don't get a good night's sleep, how is your daily function?
You're not going to be. I usually can't focus.
Okay, attention and focus, right?
I feel like you're going to be like lazy during the day.
You're going to be what?
Like lazy.
Okay, okay. Low energy, right?
Yeah.
Sluggish. Yeah, kind of like sluggish and not like wanting to do much.
Right. Again, low energy. What about moodiness?
If you get less sleep, you'll probably be more like irritated and
Irritable, right? Absolutely. We're gonna have higher irritability. What about let's see, what else? So what does irritability do for relationships? Is it good for relationships?
no.
No, it's not. It's going to strain relationships.
It might lead to depression in the long run.
Right, right. So what you see here is this cycle. So sleep affects functioning. Functioning affects life sustainability, like your job and relationships, and maybe even hygiene, right? And if your life is affected, that's going to increase anxiety and depression, which affects what? Your sleep. So you see how that goes. It all feeds in to the same loop. So that's why I look at sleep as a major contributor to anxiety and depression. And sometimes anxiety and depression cause sleep problems. Sometimes sleep problems cause anxiety and depression, or at least hinders my ability to help somebody overcome mental health issues and transfer coping skills to them. So I look at sleep as very important, almost up there with dietary. Diet is important as well. Nutrition, making sure that their appetite is good and they're eating the right things, that's up there too, because we need that for growth. We need that for our brain to operate. We need nutrients for that to occur. So sleep is also equally important because it rejuvenates us. Remember, we talked Wednesday that it restores functioning within not only our body, but within our mind too, right? So sleep problems can lead to many, many other things. How about health issues? What health issues, medical issues, could chronic sleep issues result in?
Probably like something dealing with your heart.
Okay, absolutely. It's been linked to
Heart disease.
heart disease. Absolutely. Now, why is
Okay.
that? Why do you think?
Because
So
during
I
sleep,
think
the heart rate slows
remember,
down.
Okay, heart rate slows down during sleep. What else?
I, I think that's when you like your body kind of rejuvenates and like repairs from like the being worn down throughout the day and everything. And if you don't have enough time to repair, and the heart needs time to repair too, and if there's no time, then it just keeps getting worn
Right,
down.
exactly. Because your immune system and growth hormones, GH, I listed as, occur. They really kick into overdrive during your N3 deep sleep, non-REM stage of sleep, right? So if that doesn't happen, then our body doesn't restore itself. And if we have any kind of diseases or heart palpitations or heart problems, it's not able to restore itself because we don't have the growth hormones released to restore those tissues and those fibers. Likewise with the immune system. If our body's under stress, our immune system goes down. So all these things affect us. What about diabetes? Why do you think diabetes? What's a big contributor to sleep issues and diabetes? How about we're sedentary, right? We already said low energy. So if we're not getting enough sleep, we're probably going to be more sedentary the next day. We're going to be seeking out sugary sweets to boost our energy, which could overactivate our pancreas, right? And lead to diabetes if we're prone to it. So a lot of things can be linked to sleep problems. And that's why we look at this as a potential marker for other issues, including mental health issues, right? Okay. So, so some sleep disorders that your book covered. were nightmares and night terrors. What's the difference between nightmares and night terrors? Anyone care to be brave?
Is night terrors kind of more or less like if you have maybe like PTSD for something, like maybe you went to war or something like that, and it probably affects you later on, or like you just have them constantly at night, but then like nightmares are more or less like, you know, something that just terrifies you in general, probably like, you know, something
Okay.
you see.
Mhm.
Thing.
Okay. Activation, synthesis. Did we cover activation synthesis theory on dreams?
Yes.
Okay, I thought we did. I usually cover that. So you're right, to a point. Now, night terrors occur in non-REM sleep, which means our cerebral cortex, which is the outer layer here, is not activated during that time. All right, and that's the area that's our human brain. That's what separates us from the animal kingdom, is our evolved cerebral cortex. That's where our judgment happens. That's where our regulation of emotion happens. That's where our fine motor skills.
How does the night
What's that?
terrors? How does the night terrors like fit in with like my daughter? She's almost 3. Like, how does it fit in with her? Like, I've never like noticed her like ever having like a night terror.
Okay.
I don't know how like it develops with like little kids.
It's actually very common with little kids, and there are several reasons that we know that it occurs. And somebody mentioned a good example earlier is PTSD. Now, that's not saying that somebody that has night terrors necessarily has PTSD. Okay, what that's saying is people with PTSD tend to have more night terrors than anything else. That's symptomatic of PTSD. However, when children are growing, and this will probably better explain it. You have your lower brain here, right? Your limbic system. This is your animal brain. This is where we all engage in fight or flight. This is where our heart rate is regulated. This is where our body temperature is regulated. This is where we get signals to get food, to seek out food, to procreate. So all of our animalistic instincts happen in the lower brain. So what happens in night terrors is, for whatever reason, something either during the day has activated this animalistic brain. So we're in fight or flight mode for whatever reason. We may not be aware that we are. And when we get into stress and emotions, I'll talk more about this. But paying attention, I could talk to somebody and say, "Are you stressed right now?" And they might tell me no, but I can see just in their neck that they're already tense. So I can tell just by looking at somebody whether they're activated or not. So we may not even be aware of that. And children, especially growing, they might be going through some kind of processing. They may be worried about something at school. There's a lot of changes that occur in a child's life, and their lower brains are very well activated while their cerebral cortex are still developing. So what happens with night terrors is non-REM sleep. We don't activate, we don't access our cerebral cortex just yet. That happens in REM sleep. That's where the dreams occur. That's where we start processing outward all these signals that are happening in the lower brain. So, but during night terrors, we're not aware of what's happening, and we just might sit up in a panic and sweat and heavy breathing, gasping for air, and frightened. And we don't know why, because our cerebral cortex hasn't kicked into REM stage yet. Does that make sense?
Yeah.
Okay, all right. I know that was a very long-winded explanation for that. So that's really the difference between nightmares and night terrors. Is night terrors are non-REM and nightmares are REM. We're more aware of what's happening with that, and we may not wake up in a panic. We may just remember something very frightening. Now, a lot of the work that I do, especially with people that experience nightmares, is working with them in mindfulness and helping them to not be afraid. I think if you remember on Wednesday, I talked about CNN, watching CNN or Fox News or MSNBC and looking at the big screen, and you have that ticker across the bottom. So that's kind of what nightmares are and automatic thoughts are. It's that ticker across the bottom. It's nothing to really be scared of. They're things that we automatically go through anyway. So just being aware of that and having people maybe look forward to nightmares and not giving them that power over us is very, very helpful stuff. So, and that's kind of some of the work I do with people that have nightmares. Okay.
Dr. McMunn, I have a content question.
Yep, go ahead.
So does that mean night terrors are not remembered when you wake up?
Yes, because usually, I mean, you can have nightmares that are associated with night terrors. It could be possible that you have nightmares and wake up in a panic like you would a night terror. But usually night terrors happen during non-REM, and we know that we don't dream during non-REM sleep. Okay. Any other questions?
That's all I had.
Okay. Are you with me still? All right. So some other sleep disorders. How about sleepwalking? What do you know about sleepwalking? What have you heard about sleepwalking?
You don't remember.
Okay. Okay.
It's best not to wake them up, like while they're around. I don't know if that's true though.
Okay. Don't wake up. All right.
But you remember in one of the things they were saying about like some part of your like some part of sleep paralyzes your body so you don't get up and act out the actions in your dream. And I guess that's probably like, if that doesn't happen, if you don't enter that part of sleep that paralyzes you, that's probably what causes you to sleepwalk, right?
Right. And you're absolutely correct in that. Was that, how do you pronounce your name? Is it
Best.
Bass? Okay. I play the bass, and it's bass and bass are spelled the same. So thank you, Bass. You you brought up a really good point there, is that our bodies are supposed to be paralyzed at night. Oh, I'm sorry. My screen is not sharing anymore. Let me fix that. So when we go to sleep, right around N2, non-REM2 and non-REM3, our body starts releasing high amounts of GABA.
No, sir. We were able to see your screen. Now we can't.
Oh, okay. Yeah, I have to go back into it. I have to reactivate it. So it starts producing larger amounts of GABA into our system, which does many things to, but one of them is to paralyze our body so that whatever we're thinking in our cerebral cortex is not being translated into our actions. So our vision, our hearing, partially activated because they're not muscle memory, they're not muscle movement. Our eyes, the muscles in our eyes, weirdly enough, are really the only thing that aren't affected, hence the name rapid eye movement, REM, because you can tell somebody's in REM stage when their eyes are fluttering underneath their eyelid. Okay, so sleepwalking is a disorder, could be a disorder. It's actually very common among kids. I think up to about 28% of children have experienced sleep disorder, sleepwalking at some stage. Usually around early childhood, early teens. Tend to grow out of that after the teenage years. So that doesn't happen. Your body is not paralyzed, and what you're thinking and what you're maybe even dreaming is being translated through movement, either through your arms or through your legs. And some people are really skilled sleepwalkers. They can negotiate the entire house and go into the refrigerator and get into things and eat. That's a real thing. So yeah, absolutely right. Your body is no longer paralyzed. Now, you said that you don't remember. Sometimes yes, sometimes no. So I've worked with a lot of people that have reported sleepwalking, and they do remember dreams. So that's kind of hit and miss. Don't wake up. What do you think? Is that true?
I heard that if you wake up somebody who is sleepwalking, when they're in the state of sleepwalking, there's like something that like triggers them a lot easier. Or like if you scare them, they may like react in like a very like spontaneous like reaction.
Well, yeah, imagine that. Imagine you're sleeping in your bed and somebody walks in and shakes you awake. Are you going to be disoriented? Are you going to be confused? You're probably going to, your fight or flight's going to activate and you're going to come out swinging. Most people that I know would do that because they're frightened when that occurs, because you don't know what's going on. You're disoriented. So waking somebody up in that manner is not really a good idea unless it's an emergency situation. What is advised, because here's the catch to it, you got to consider safety. If a person is sleepwalking, they have a good potential of harming themselves. They could either fall downstairs or they could go through drawers that could cut themselves or bump into something. There are a lot of things that could happen if a person's sleepwalking. So the best thing to do is to either try and guide them gently back into their bed, or gently, if you need to, gently wake them up. And of course, use it with caution and just be aware that they might come out swinging if that's the case.
I was told the best way to open somebody up who's sleepwalking is to turn the lights on.
Well, that's usually hard to do because I mean, that wouldn't be a bad idea. But just turn on the lights may not work because they're not necessarily using their eyes per
If
se.
they're walking where the light is on.
What's that?
What if they're walking in a room where the light is already on?
Right,
Like,
exactly. Yep.
like
So
my sister sleepwalks and she tends to like confuse the rooms in her house.
mhm.
But, like she'll confuse like the bathroom with the kitchen. Trust me, it's really bad.
Oh no.
Yeah.
Say no more.
Yeah. So technically sometimes like she'll go to sleep and we'll still all be up and she'll just walk like around the house. And
Okay.
it's weird.
Yeah, and that's and do you usually gently wake her up if you see
I
her?
just guide her back to her bed and then she just
Okay, good. Yeah, and that's the best way to do that is guide them if you can. All right, so some other disorders. Oops. Go ahead.
Can sleepwalking be like genetic?
Yes.
Okay.
Yep. Insomnia. Oops, yeah, if sleepwalking is prevalent within your family, there's a good chance that that is hereditary. All right. So insomnia. Did I say insomnia? I meant sleepwalking. So insomnia. Now, when we look at insomnia, we consider insomnia the inability to get sleep and stay asleep or get a good quality sleep. So that is really a broad range of disorder there. So we can get somebody that maybe only gets 2 to 3 hours a night, has a hard time going to sleep, has a hard time going back to sleep if they wake up, to 0 sleep for weeks. Yes, that happens. Very rare, but there are people that don't sleep at all. And maybe they go into micro sleep throughout the day to get that REM, because your mind needs REM. Otherwise, you start hallucinating, you start forgetting things, dementia. There's a lot of things bad things that can happen if you're not getting that required REM. So insomnia can occur for many reasons. It could be a chemical imbalance. It could be it could be some kind of chemical dependency, substance abuse, or substance use. Interestingly enough, what do we see a prevalence of with insomnia as far as
Depression.
depression? Yeah, depression is one of them. How about addiction?
Yeah, meth and coke.
Yep. Self-medication. Usually alcohol or cannabis or benzos. We usually see substance abuse mixed with insomnia, because that's the only way that they feel that they're able to get sleep. Sometimes, again, it's a relaxation. Usually with insomnia, I would venture to say that it's probably something more medically than it is relaxation, but we attack it from when I encounter somebody that has insomnia, We attack it from a medical point of view. We get blood work done to see if there's anything being released in their body. Maybe they have potassium deficiency or something like that that's getting their heart rate, irregular heartbeat. And I also teach them relaxation techniques, which when we get to stress and relaxation or stress and emotion, I'll walk you through and show you what that looks like. But yeah, usually we see people self-medicating associated with insomnia. Your book also talked about sleep apnea. Now, we are probably learning more and more about sleep apnea every day, okay? Sleep apnea is associated with snoring. But it's important that snoring does not necessarily mean that somebody has sleep apnea. Sleep apnea is defined as stop breathing for 10 seconds or more throughout the night, okay? And that could be for one of two reasons, because of a central nervous system shutdown or an obstruction. Now, obstruction, we're going to see more associated with snoring. Obstruction means that either your tongue or your adenoids or even your tonsils are blocking your airway when you sleep, because normally your airway is supposed to be open. You have muscles that retract all that and opens your airways when you sleep. So people that snore have that obstruction, and if it causes such an obstruction that they can't breathe for up to 10 seconds, we can diagnose that person with sleep apnea. And what winds up happening is their sleep is disrupted and they have to wake up to gasp for air, which again affects their REM sleep, right? Which we need. And we've associated sleep apnea with heart disease, with diabetes, with immune system issues, right? Now, CNS is a little bit different. CNS is a signal within your brain that tells your lungs to keep functioning. When your central nervous system interrupts your breathing, that causes you also to gasp for air. It's not necessarily an obstruction, and you may not snore, but you can have sleep apnea and not even snore, if that makes sense, okay? All right. Any questions on sleep disorders?
There was one question. A student was asking if you have insomnia. There's sometimes people say that they sleep with their eyes open throughout the day. Is that true?
I haven't heard that one. They sleep with their eyes open throughout the day. They might go into what's called microsleep, which looks like not necessarily narcolepsy. It might just be narcolepsy is when you shut down and go into REM sleep almost instantaneously, and nothing wakes you up. With microsleeps, it could be maybe if you can kind of relate to this, maybe you were up really late at night studying, and then the next day you were sitting at your desk or in the auditorium or something, and you just start dozing off. That's what a microsleep might look like. Your mind just kind of shuts down, glosses over for a little bit, and then you're back to it. So that's usually what happens with people with insomnia. Not necessarily that their eyes are open. Maybe they might get heavy. Some people are good at maybe dozing off with their eyes open, but usually you can tell if somebody's dozing off because their eyes are just all over the place. All right. Any other questions or comments on disorders?
Is sleep paralysis night terror or nightmare?
Sleep paralysis. You mean when you wake up and you can't move?
I think so. There wasn't much elaboration. So
okay. So sleep paralysis is a phenomenon that occurs when your mind wakes up and you haven't really flushed your body of all those neurotransmitters that paralyze us. Okay, so sometimes that happens. It takes a little bit. That's why you feel groggy when you wake up. You get up in the morning and it takes you a little while to move. That's because your body is just still trying. You have all those growth hormones. You have everything that's really still functioning and pumping in your body until you get moving and get working, and then blood's flowing and Yeah, so sometimes it takes a little longer for some people to get over that sleep paralysis. But sleep paralysis happens naturally while you're in REM sleep anyway. Okay.
And then the last one I have is someone I know got the roof of their mouth shaved, tonsils out, and uvula removed, and still has it. Why does she still have sleep apnea?
Well, it could be her tongue. It could be a number of any reasons. Maybe it's, I mean, if they diagnosed her with obstructive and she's still being obstructed, there's something still in her airways obstructed. Usually, yeah, that there's not there are, sometimes those treatments help, but they're not always 100% effective.
And that's all I have.
All right. All right. Well, I was kind of hoping to get into hypnosis today. You all asked some really great questions, and I'm glad you did. So unfortunately, I don't have a lot of time. I do want to leave a little bit of time here to meet with anybody that has any questions. So that's it for my lecture for Wednesday. I'm sorry, for Monday. I will be on here. I won't be doing any lectures. I'll resume the lecture on memory on Wednesday. But so if you need anything, if you have anything you want to talk to me about, I will be available Wednesday at 2 o'clock to talk about it. But otherwise, I'll see you all back here on Wednesday. All right. Any other questions?
Yeah, I got one. What's the difference between, like, is there like any, you know how there's like the stereotype of like light sleepers and heavy sleepers? Is that just like depending on what stage they're in?
It could be how much time they spend in one stage. Like some people might spend a lot of time in N3, non-REM 3 stage. And if you remember, REM are just short little bursts. They don't last very long at all throughout the night. But non-REM, if they spend a lot of time in there and they're accustomed to their environments and they feel safe in their environment, then they're going to be a little bit more relaxed. So that tends to mark somebody that's a heavy sleeper. I was in the military for 20 years. So a lot of the places that I've been to really did not promote me to be comfortable where I was sleeping. So I'm a very light sleeper. Like, if anything happens throughout the night, I'm usually up listening to it and trying to figure out what it is. But you know, you have different people with different experiences that really mark that.
Gotcha.
Yep. All right. Any other questions?
I have a quick question.
Go ahead, Matthew.
So what would you say is like the biggest difference between nightmares and night terrors?
Nightmares are the actual bad dreams that you have. Where night terrors, you may not remember at all. You just wake up in a panic. Your body is in fight or flight mode. Your heart's racing. Your breathing is shallow. You might be hyperventilating. You're sweating. Those kind of things. Your muscles are tense. So if you imagine like you encountered a bear, but you don't remember encountering a bear, that's what a night terror would be.
Okay, thank you.
Okay, you're welcome. Any other questions? All right, y'all had some really great questions. I appreciate your attention today. I hope you have a restful and relaxing weekend. You know, I probably have a lot of work. If you're anything like me, got a lot of work to do, but try and find some time for you, okay? That's all I have. Have a great weekend, everybody. I'll stick around for a few minutes if you have any questions or one-on-one.